Yeah, that's another one. So that's a good question. An asymptomatic hernia means by definition it doesn't cause any symptoms. It's not causing you any problems. Should you have it fixed? Well, the answer is you could have it fixed. But because the only fix for a hernia is an operation, you have to think about, well, what's the potential risk and outcome of an operation? And one of the risks and outcomes of surgery is that you always have a scar and some scar tissue, and that causes stickiness of tissue. And that can lead to discomfort, not necessarily pain, it's just discomfort. You might notice it in certain situations, you're doing something and you think, oh, that feels funny. Whereas if you haven't had the hernia repaired, you would never have that. So you could get into the mindset where the hernia repair feels negative if you had no symptoms before and you have a few symptoms after. And so you might not like the fact you've had it repaired as much as if you had symptoms before you had it repaired that were stopping you from doing things you want to do, and then those symptoms are resolved, but you get a little bit of occasional pulling or discomfort with certain positions, then your mindset may be that actually you've had a very positive experience, and it was worthwhile having that hernia repaired. So that's an important thing to consider when deciding whether your asymptomatic hernia should be repaired now or left. If you leave a hernia that's asymptomatic, the chances are 70 or 80% will become symptomatic and start putting you off doing things in about 18 months, in up to 18 months. They can also get slightly larger and the defect can get slightly bigger. That doesn't make a massive difference to the repair, but you can get to points where you've kind of ignored that and forgotten about that, and then it does start to impact the ability to repair it.